Irrational use of medicines remains a serious problem, especially in developing countries. It is particularly serious in regard to the misuse and inappropriate application of antibiotics, resulting in the waste of the scarce resources.
People use medicines until such a time that they think they have improved and leave balances for some other time, when actually it is not warranted. Whatever medicine you get at a particular time from a responsible health provider is medicine that is supposed to be used to address that particular health problem you have.
In Uganda, a study conducted by the Ministry of Health and partners in 2008 on the desirable use of medicines found that 40% of households kept medicines at home for anticipated future use, 34% of households were found with antibiotics in the house, and 36% of antibiotics were carried forward from previous treatments.
The situation is, how do they keep those medicines? In what do they keep those medicines? Where do they keep those medicines? And ultimately, we know that memory has limits. Who gives them information of how to get onto using those medicines at the time that they eventually choose that they use these medicines.
Besides, wrong use of medicines dramatically leads to drug resistance globally, often requiring governments to change treatment regimens to more expensive ones.
Remember, medicines are also poisons. So you take more of them, you have the disaster related to poisoning. You undertake them, your body gets used. The microbes or the bacteria or the parasites get used to them, and they become resistant to this medication. And ultimately, when you are given these medicines again in the future, you will not get well.
Other challenges to the rational use of medicine include widespread self-medication, negative beliefs and misinformation on medicines, unqualified medical service providers, and lack of policy on medicines pricing, among others. Data also goes on to show that problems associated with misuse of medicines are worse in the private sector. Anna Tkunda, NTV 11.